Cleveland Clinic survey recently found that close to 60% of males don't go to the doctor when they even suspect that they have a severe illness. My name is Brian Pollack. This is Minding Men on Mainline Network. And today we have Dr. Adam Kimowitz joining us. He has years of experience in cosmetic dentistry, implantology, and prosthetic reconstruction. He graduated from UMDNJ, New Jersey, and is a fellow of the International Academy of Dental Facial Aesthetics, as well as an associate fellow of the American Academy of Implant Dentistry. He maintains a full-time private practice with his father, which was established 42 years ago, and he focuses on implant and complex restorative dentistry in Denville, New Jersey. Dr. Kimowitz, thank you for joining us on this important topic.
Thank you for having me.
Absolutely. We're going to get right to it. One of the things you and I often have talked about is this fact that men struggle to get their behinds into the dentist chair, into the medical office. What do you think stops them or hinders them from coming in?
It could be so many things: fear, anticipation in their head as to what they're going to expect. People often feel like they're going to be judged, and I think our harshest critics are ourselves. But when we hear it, it's the perception of what others are going to think of us. And one of the things that we talk about, and I hate to use the word toxic male culture, but the inherent part about that is that we have a tough time coming to terms with our own feelings, even as men, accepting them, living it, and leaning into them for really what they are. And that to have to face that, it really makes us confront our own mortality, and that's scary as hell. So even as a male myself, I mean, I try to, when I see patients, take a humanistic approach. I say to them, don't call me doctor, I say, call me Adam. I'm just another guy just like you, just another person just like you. I bleed just like you. I cry just like you. It's okay. I'm not here to judge, I'm here to help. Once we cross that barrier, they then could be made to feel safe, and then that really allows the true care to begin.
Oh, interesting. So from the very beginning, the approach you're having and that humanistic idea is that you're actually allowing someone to connect with you as a doctor, which often I think is something we don't really often experience in the doctor's office.
So the problem with medicine today, the problem everywhere, medicine's not even medicine. It's so metric driven. It's so like key performance indicators. You look at like CVS, you look at the hospitals, how many numbers are we managing our costs and insurance. It's never, and unfortunately in school, even when I'm an educator myself, but even in school, it's about what can we do to pass the grade, to meet the performance metrics, to make doctors, to get past our boards, to do all those things. And what it gets our minds to do, our minds go into this. I think every medical professional goes into this in that I want to help. It's not I want to make a lot of money. There are easier ways to make money than in the health professions. You have to give of your heart, soul, and I think one of the things that we do this is we want some degree of autonomy, which is being taken away, right? We want some degree of purpose, which I think is very important, and we also want the ability to care for others. When you have those performance metrics put in place now, and you have people working for people or even their own practice and saying, I have rent, I have bills, and all those other things, the doctor, it gets in the way of care. And patients perceive that. So I may be the worst clinician in the world, but if I can connect with the patient and make them feel safe, they feel that they're in good hands. So what I tend to try to do before I even see a patient and provide care, even before I say, oh, come in, we need x-rays and we need records, I sit down. I actually have two chairs in my office. I have a talking chair and I have a driving chair. With COVID, it's a little different because we're doing virtual intakes. But my talking chair is really this. I sit knee to knee to the patient. I'm not like awkwardly close talking, because nobody likes awkward close talking. That's really uncomfortable.
I don't know what you're talking about at all.
But I sit to them and I say, listen, what's going on? How can I help you? What is it that you're here for? And when they come in my office, the patients don't necessarily come to my office for fillings. They are major functionally impaired. They can't chew. They won't smile. They have so many physical disabilities which basically impact them mentally. Meaning, imagine not smiling and just looking away from people because you're insecure as you perceive people will judge you. It impacts job, it impacts relationships with family, friends, professionally. And to break through those barriers, to get an understanding from these people, why, because the first part of them is accepting the problem for what it is. So many people have come into my office and it's been years till I can even walk through the door.
Yeah.
I'm so scared.
Yeah.
It's so fear driven, and oftentimes with fear, with men, it manifests itself into aggression. You know, or severe depression. So much is in anxiety. So much gets in the way of really achieving our true potential as people,
Yeah.
and finding. Like, I don't want to use myself as a Sherpa, but somebody to kind of guide them with a set of skills, really help them get what they deserve as a human being. That's really what I think men, and more specifically humans, are just looking for someone that can hear them as a person and not just look at them as a metric. And that's really what's missing.
I agree. And I know you go around the country talking to your fellow doctors and colleagues about this often, and also helping them learn to be better dentists technically and educationally. But one of the things that you're bringing to a really wonderful point is, these people coming in, they're already recognizing a problem. And if there's anything, when we live as a guy in this world, there are limitations to our allowance often to recognizing that there's something wrong with me, that I have to get something checked out. And particularly in dentistry and also in other medicals, but I would think the automatic invasiveness that it requires for a guy who can be very much either closed off or sad or avoidant or just not wanting anyone to be near him. I can imagine just that, having to break that barrier, almost having to be something that you constantly have to be aware of and work towards a comfort level with them.
It is one of those things, and a good friend of mine who's also he's in the mental health business. He has a philosophy. He says it's all about fit. It's all about fit. I'm not for everybody. Everybody's not for me. But when there's a beautiful fit, like a marriage, it's beautiful.
Yeah.
And I spend a lot of time investing early on, because the treatments I do, they're not just one time. They take place over months to years.
Yeah.
And there has to be a good fit. So for us to be very outcome driven, one, we do a psych assessment, and we do a fit assessment. One of it is to understand, if that person has enough self awareness to say, I'm scared. I'm nervous. I don't know. Can you explain? And I feel that for me, it's my job to really treat the person and not the mouth or the set of X-rays,
Yeah.
and really get a sense of, okay, you are fear. Okay, we have protocols in place to address your fears, whether it's pharmacology, whether it's talk, whether it's information. I make myself available to people on weekends via cell phone and text. It's just so a lot of people, if they have a problem, they'll Google stuff. Like I'll be perfect honest with you. In every pathology class in school that I was taking medicines, I thought I had every disease under the sun because I'm so neurotic. People by nature are neurotic, but the fact is, it's like a bad Larry David episode.
Yeah,
But the fact of
absolutely.
the matter is, it takes self-awareness, investment in yourself and other people that will believe in you to get those things out. That's why I think it's paramount. I believe everybody should be in therapy, even if there is no mental illness, just as a way to have that self-awareness. These are my triggers. These are the things that I'm nervous about, and then communicate it to the appropriate professionals or people in their life so that they're sensitive to that. So we invest heavily in that human dynamic.
Yeah, let me jump in. For all those people that
Sure.
didn't turn off because he said everyone should be in therapy, because I think he's right. And someone watching going, oh, therapy, forget it. Therapy is important. And what I really want to point out and ask you, Adam, as you're talking about this really important part, is when you're going to work with someone and you're looking at their mouth and their x-rays and everything, how much do you think that the deterioration or the difficulties they're experiencing with their teeth and their gums and, let's say, their hygiene has to do with mental health?
Absolutely. Absolutely. I think therapy, I think just in general self-awareness, knowledge of self allows us to cope with stress. You know, Stress, whether you are the most, you're just bound with fortitude and you're the strongest physically and mentally person, we all have stress in our lives.
Yeah.
People die. People get sick. There's just a lot that goes on in dating stress. It's not that I heard a wonderful quote from somebody one year. I mean, this was maybe 20 years ago. Her husband passed away recently. No, not recently. He passed away 20 years ago. And she had this on screensaver. We can't control the way the wind blows. We can adjust our sails. That was the quote. You cannot control what life throws at you. You can only control yourself and how you cope, manage, and deal.
Yeah.
So ultimately, getting back to what you were saying with those patients, we talk about that, and if they don't have that self-awareness and it manifests itself in aggression, or this, maybe they're just not ready. Maybe they're just not there in the right headspace to do it. And ultimately, it's my job to work with them and really see if they will be a good fit. Yes, I could physically treat almost anyone, but also for men, they may not be in the right headspace to go ahead with enhancement or even treatment of infection unless a fire happens, which is the other part, the sense of panic, that immediacy which causes anxiety, which makes people immediately react, and hopefully it's rationally, and sometimes it is irrationally, where they do come into my office as if the sky is falling.
Yes.
And that is crisis mode in dealing with trauma, which is what we do a lot of, and also managing these people. So I don't have any formal mental health training as far as, but I feel like I'm kind of an amateur, amateur therapist to a degree, because people that I see have been faced with trauma, victims of domestic abuse, auto accidents, violence, whatever, or just years of collective trauma by self-imposed trauma, by just avoidance, right? Avoidance and avoidance and avoidance, and it's self-imposing. The biggest problem I get from men is they come in and they say, Doc, I have to tell you, I didn't do this when I was here. You ever see Chunk from Goonies when he was complaining and he's like, and I was at the movie theater and I made a sound and I was good. He was completely confessing to the Fratellis, right? And that's when people come in and I say, I am not a priest. I'm not a rabbi. I'm not God. I'm DMD. But I'm not here to judge. I'm here to help. So teach me what you're going through. Tell me about your pain. Tell me what's bothering you. And let's come up with some mitigation strategies for this. And then we get to the diagnostics.
I think that's great. So you're not getting to diagnostics right away. You're going straight into the idea of who are you as a person, and really, when you make the individual. By the way, I don't think you're so much of an amateur on mental health. I think you have way more knowledge than most people, because you're able to see how this all kind of intersects. And when a man comes in and you allow him in a good way to utilize some of the masculinity traits he has possibly been trained to do by society, like need to take charge or get over it or push through or whatever it may be, and you can aid in that and support him and push him into seeing more as he leads you, which is the whole trick. He will relax. People do relax into that because they need to be their own authority. They need to be able to say, this is me. People are afraid of that. Men are afraid of that in situations around doctors. There's no doubt.
If I can acknowledge it, they can acknowledge themselves.
Yeah.
I can validate it, that whether your fear, your feelings are real, your response is real to you, it's 100% real, it's bona fide. Whether you think it is or isn't, this is how it's presenting. It's real, and we acknowledge it. And when they can acknowledge it, and they know that someone hears them, and I say this: there's only one diagnosis in anything. There's only one diagnosis. There are multiple treatment routes.
Yes.
You can treat something with there's multimodal ways of treatment. So there's only one diagnosis. So we can do a human-based treatment approach. So and so is a single father, 3 kids. Wife died of cancer and can only come this time. So we only can deal with the duration, or we need to phase things. We'll treatment plan according to the life of the person to reduce their stress, which makes them a better patient, gives better outcomes, and then eventually allows them to face the world with more confidence, and then address some of the mental health issues they've had as a result of their conditions.
Yeah,
it's a beautiful thing. I mean, to see the stories, we could do a whole show on stories. It's all about stories. And I always, when I try to give people hope, I try to tell them the stories. I said, John is just like you, Bill. John is a situation, and I don't tell him John's last name or anything else, but John came in And John had a situation where very similar to you, and this is what's going on. And I have like a slew of patients that fit profiles that are willing to talk to other patients going through the same situation, which really helps them.
That's great.
Yeah.
That's really great. You don't hear of that very often. And, it's interesting as you say this. I think so many times that, particularly in dentistry, I have a bunch of male friends who will drive hours to see a dentist. It's not like the dentist in their town. If they find somebody who gets it, they drive there because they are being attended to, because it is, for a lot of people, a scary thing. And they need that relation of people that have been through these things and the support along the way. So I'm really happy to hear you're doing that. It's
It's
super important.
fit too. A lot of men in general, it's a control issue. A lot of men in general have difficulty giving control to someone else. If they feel like they do, they feel less than. If they
Yes.
feel weaker, they feel that they're not doing for themselves, or they're not providing in a way. When somebody's in your face, literally, we can't social distance in dentistry. I'm this close. We just can't. And you're literally trusting someone, literally 2 to 3 inches away from your brain, right? There has to be, for that to work out and to have a good outcome, there has to be that rapport. There has to be. For there to be success, there has to be rapport. Some people have such fear they can't even walk through the door without being put to sleep with anesthesia. But that's why we have an anesthesiologist,
Yeah.
for those unique situations. That's why we put people to sleep. I do work with pharmacology in certain situations, but again, it's fit. And I also say this to a person. I said, these are the options. I said, you know you better than I know you. And I always say, you know you better than I know you. These are the options. What do you think would work best for you? You
Yeah,
know? So
absolutely. It's really great. Control is such an important aspect that you mentioned. This idea of being a guy and needing to be successful, look successful, have a successful smile, to be in power, what that requires, and also to have the control that all of that is put together. I'm sure people are coming to you really wanting, let's say, that new smile that will offer them all of that, but yet they're still scared because they're not sure what's going to happen. So I'm really happy you're recognizing that, particularly with the word fit. I think that the matching component is great. It's really nice to hear.
so I think the glue in all this, for me to be successful as a person, for any professional, for a patient to be successful, is a few things. One is empathy. That's the glue in everything. Empathy for others, but also empathy for ourselves, being good to ourselves, not being so hard on ourselves, practicing that self-care, acknowledging that we have weakness, acknowledging that we do have fear, acknowledging that we do have stress, and then not just putting it away and not dealing with it, but coming up with ways of dealing with it, which is why I say everybody needs to be in therapy. Some people riding a motorcycle is therapy. Some people art, playing guitar, listening to music. Things that, for me, I guess during pandemic, I got into TikTok, which I had to stop using, watching like stupid, it's like turning the noise down a little bit. But like, I love reading. I love reading, playing with drones, those things. But it's like, what turns the noise in our minds down, even daily, to give us some serenity to deal with? Again, what can I control? I can't control. I can control myself. That's it. That's all I can control.
Fantastic. Now, empathy is something for a lot of guys that feels possibly out of control because you're feeling for something outside of yourself. You're caring for others. And so you can't control how that person feels, but you can feel them out or just say, I understand. Do you have any tips for anybody watching of how to embody empathy? How to make that happen?
Um, it's hard to teach empathy, but there are tools and things to acknowledge that you are empathetic. So I can't, from my screen, look at you and say, "Oh, I see Brian's empathetic beams just shooting out of his head." I can't. But what it can be, one of it could be through body language.
Yeah.
And so body language is looking someone directly in the eye and acknowledging them, not looking at your phone when a patient is coming in, even when a person or with your families, right? That shows you're distracted. That what they're saying is not is less important than what was in your mind.
Hmm.
Looking away, being distracted, whatever. Grabbing a drink of water. Well, you can if you're thirsty.
Yeah.
But another thing is too is body language. Arms crossed. Somebody's thing like this that doesn't show an empathetic, that shows a confrontational tone. Repeating what somebody says and saying, if I heard you correctly, let me just kind of see if I understand you correctly. And then I always, when I see patients, to sum up and said, your chief complaint is this: difficulty chewing makes it very embarrassing for you to go to meals, and it really upsets you from what you told me that when you speak, you're slurring your s's, and that, and I get that, and I always respond with, I understand.
Yeah.
So it's the verbal cues, the body language cues, and just posture in general. That is a way of acknowledging that you are empathetic and hear people. So I can be empathetic, but if I kind of,
Yeah.
that's the awkward silence, right?
Yeah.
If I give you the awkward silence, um, then you may not, I may be empathetic, but you would never know it. So I think communication is everything, and the embodiment of connection is acknowledging others. You may not agree, and you don't have to agree. You can completely disagree, but you can say, if I understood you correctly, that.
Yeah.
No.
Well,
And
and it's great that you're giving activating ideas about this, because a lot of times what men often will do is they kind of freeze, or we have to give men more credit than they are given around emotions and being a guy and connecting with things that might not be as strong all the time. Like, we are able to read faces well. We can understand, how someone's feeling. There's a big exchange. There's even something called mirror neurons that we're actually immediately able to understand how someone's feeling. But a lot of times, because men are trained in our world or even told that they can't have certain emotions, they shut off when they hear those or feel those situations or those mirror neurons, and they end up like this, or they end up closed off. And so being able to remind people over and over again that, hey, I'm open, I'm here, I'm with you, or just repeating and validating that, by far is an amazing first step for a lot of guys as they are trying to make sense of this. And even in the doctor's office, I think it's an important thing to do.
honestly, I think it is masculine and cool as hell to be able to connect with people. I think that's kind of the older notion of masculinity. For
Yeah.
me, being able to have quality encounters with friends, family, and patients is cool as hell. I lead a rich life. It has nothing to do with how much money I make. It has to do with the quality of the relationships I have. And I am so damn protective of the people that I love in my practice that work for me, that when there's a bad fit and somebody comes and screams and this and that, I can't control that, but I can control the environment and saying, listen, I'm not going to allow you into that space to be toxic. Some people aren't ready to get out of that shell. So the fact is of being able to acknowledge feelings and be able to talk about it, it's not a wussy thing. It gets people to build more rapport. It assesses fit better. That's what relationships, friendships are all based on, and also productive patient-doctor relationships. When somebody's like, "I love my doctor," he or she hears me. Or I say, "No, I love my patient." They're so upfront with me, even though they know they're high maintenance or they know that they're this or they need that. If they can communicate that, then I can address it. So not everyone's ready for that. That's the basis that my practice is built upon. But and again, I'm not for everybody, but I'd rather have a more quality than quantity and have just rich, meaningful, outcome driven patient encounters.
Yeah, I think that's really great. By looking at all of this experience that you've had, all these people, all these things you're doing, it kind of makes me think, um, American Medical Association, hey, doctor worlds of ethics and values and limits and boundaries. I sometimes wonder if that needs to either be rehashed, relooked at, or what, because so many times I think what we've learned expectations of doctors is you go in, you're told something, they weigh you, you say, my toe hurts, that's the end of it, and they go, okay, here's a prescription, see you later. And to hear that that's not happening at your office, and I'm sure at many other people's offices that are learning from you through the American Dental Association or other fellow or educational stuff that you're doing, is fantastic.
Shout out to the American Academy of Implant Dentistry.
There you go.
Yeah.
I'm sure they're all cheering in the background right now. And there's this part of it where I've always appreciated how you approach clients or patients or just people. And being able to just exemplify that and show the excitement you have is super important. I wonder if you could say one thing to the guys who are watching this, what
You know,
would you say to them?
so the one really tough thing today is that the world is based on metrics. The world's based on metrics. In schools they teach to we can look at a bank account. We can have quantitative measurements that we got this amount of money, or we saw this more patients, or we worked X amount of hours per day. It's very hard to measure qualitative things. It's
Yeah.
very hard to measure certain things as far as the feels. And I know it's the feels, but ultimately, it's hard to measure the feels.
Yeah.
But why do we make choices to go on to a restaurant somewhere, or hang out with one person, or go to one doctor? It has nothing to do with, well, their wait time was 7 minutes and this guy was 5 minutes. It's all about the feels. It's all about the qualitative, which is the hardest to measure. And we can't teach the qualitative. So I like to talk about our medical model is competency and proficiency based. We as a medical model, we just test the competency. They meet the minimum standard. We be living to proficiency. So proficiency is the highest standard of clinical care, diagnostic care, and that and truly connecting. And it's hard to teach that, but it's possible. So every time I teach, every time I talk, it is so injected with the philosophy of doing things based on what's here and the feels. So that's ultimately it. So it's do it based on the feels.
Part of me wants to say hallelujah.
Yeah.
Can you please just tell everybody where we can find you?
I practice in Morris County, New Jersey, in Denville. In
Website?
DenvilleDentist.com. DenVille dentist.com.
Thank you, Dr. Adam Kimowitz. Adam, you're amazing. You are the best. I would never go to any other
You
dentist in
are.
the whole
You are.
world. We love you, and thank you for being here on Minding Men on Mainline Network during COVID. I wish we could be in the
Great.
studio. Till
Absolutely.
next time, my friend, all right?
Thank you so much.
Be well.
You too.